Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the week ending April 29th, 2021. This week, I'm going to answer two questions, basically framed as three. How is the pandemic progressing globally in the U.S. and in our region? What did the CDC say this week about people who have been vaccinated? And what did Governor Lee say this week about mask mandates? Those are both questions that have come in. But really, what's behind both of those questions for most people is, what does this mean for me? Where and when should I wear a mask? So those are the two questions I'm going to pose this week. In terms of the pandemic progressing, the world has passed 3.1 million deaths, at least. That's a minimum number. A 3% increase in the past week. In other words, 3% more deaths this week than there were last week. We follow this percent growth, and I'm actually quite concerned about this because 3% is actually the highest we've had since early February. And it's been a little bit lower. Now it's stayed at 2.9, 2.93, so we'll keep an eye on it. But this is worrisome. It's 92,000 deaths last week, over 9 deaths every minute. If you look at the daily number of deaths in the world, you can see there was a spike in March of last year, and then fairly even numbers throughout the summer, and then this huge spike in the fall and winter, and then it dropped, but now it's coming back up. And our number of daily deaths now worldwide is almost as high as it has been at any time during the pandemic. Now, one of the reasons for that is that the pandemic is evolving differently in different countries. If you look at this map, you'll see a few countries like United Kingdom and Spain. These are the 9 most impacted countries in terms of cases. You see the United Kingdom coming down close to zero, Spain coming down close to zero. You see a couple of countries like India, where the number of deaths is just skyrocketing, as it is in Turkey, as it was in Brazil, appears to be coming down a bit. But really what I find most worrisome is you look at countries like France, Russia, Italy, and perhaps even the United States. And what we see is that while it has come down from the peak, it seems to be leveling off. So it's something to definitely keep our eye on. In terms of deaths per million, this tells us which countries have been the most heavily impacted. There's the United States at number 12. And this means that for every 560 Americans, there's been a death. This is a significant pandemic. In terms of the U.S., we've had 588,000 deaths and about a 1.9% week-to-week increase. This is the third week in a row that the increase has been 0.9%. That's good. I would like to have seen it coming down, and perhaps it will in a little bit, but we'll keep our eye on that. And even at this, there have been 5,000 deaths last week, and that's about 1 death every 2 minutes around the entire United States. In terms of the daily number of deaths, you can see the spike in March and April. We had a bit of a bump in the summertime, and then this late fall, early winter spike. It's been coming down, and then as of about 3 weeks ago, it seems to have been leveling off. We need to keep our eye on that. The number of daily deaths is about where it was for much of the summer. So hopefully we won't be seeing a resurgence as they're seeing in some other countries. Of course, we have going for us is that we're significantly vaccinating a number of folks. In terms of where the cases have been in August, September, October, November, December, January, February, March, and now the end of April. And you can see that there have been cases everywhere, but particularly up here in the north and in the southeast, and especially in our state of Tennessee. In terms of the 5 states in our region, you can see that both Virginia and South Carolina appear to be coming down pretty significantly. Kentucky, Tennessee, and North Carolina seem to be leveling off. There may be a slight increase in North Carolina. In terms of week-to-week increase, Tennessee is at the lowest, but they're all about in the same range. In terms of the Ballad Health region, we've had over 2,000 deaths in our region now, 0.5% increase about where the rest of Tennessee is, 9 deaths in the last week, over 1 death every day. We've been also watching hospitalizations You'll recall that in August and September, running about 100 a day, it spiked up to about 350, then came down pretty dramatically. But now for the last couple of weeks, actually almost 2 months now, been coming back up and well above where it was before. So we'll keep our eye on that. But in terms of the pandemic, globally, it's definitely going up. In the US and in our region, it seems to be stable and coming down. But again, because we've seen this sawtooth pattern in so many other places, we have to wait and see what's going to happen. Hopefully, the number of vaccines will start to protect us, but we'll keep our eye on that. In terms of the other question, what did the CDC say this week about people who've been vaccinated? And what did Governor Lee say about mask mandates? And thank you all for posing these questions. The CDC has updated their guidelines for folks who've been fully vaccinated, excluding those who are immune suppressed. Basically, fully vaccinated people no longer need to wear a mask outdoors except in certain crowded settings. And fully vaccinated workers no longer need to be restricted from work following an exposure as long as they remain asymptomatic. And folks in non-healthcare congregate facilities no longer need to be quarantined. What came out this week, which may be helpful, is a couple of diagrams from the CDC. And what they've got on this side is unvaccinated people, on this side vaccinated. And here are some outdoor activities. So is it safe to walk, run, bike outdoors with members of your household? Yes, for both vaccinated and unvaccinated people. Attend small outdoor gatherings with fully vaccinated friends? Yes, for both vaccinated and unvaccinated. Attend gatherings with people that are vaccinated and unvaccinated? Yes, for people that are vaccinated, but for unvaccinated folks, only if they wear a mask and stay 6 feet apart. Things get less safe for dining at outdoor restaurants if you haven't been vaccinated, and then attending crowded outdoor events if you haven't been vaccinated is considered least safe. Even if you've been vaccinated, they recommend a mask and social distancing. Indoor activities get even more complicated. And if you want the link to this diagram is there below, or you can pause this and take a screenshot. But you can see that even for vaccinated people, the CDC is still recommending that we wear masks and practice social distancing for most of these activities. And then for folks who are not vaccinated, they're less safe or least safe. So quite complicated and actually a little bit difficult to follow. In terms of Governor Lee, what he issued was Executive Order 80, which basically ends county authority to issue mask mandates, and that the Tennessee Pledge is no longer considered an independent source. And importantly, he says, because information is available and should be sought from traditional public health agencies. Very important to note that the governor is not saying that we shouldn't wear masks necessarily, or that individual organizations and businesses can't require masks. In fact, we asked for and received this comment from the governor's office. As always, private businesses are free to set up their own policies. So this is really the Executive Order 80, I would look at as a regulatory activity. The governor is acknowledging that COVID has slowed down in our state and is saying that there's no longer a need to issue mask mandates. That's not to say that we don't wear masks and we don't protect ourselves. But all of that taken together gets confusing for people. And so I thought what I would do in the next couple of slides is just tell you when I don't wear a mask and when I do. So I don't wear a mask when I'm at home with my family, all of whom have been vaccinated. I don't wear a mask when I'm walking outside, except when I'm on campus, because campus has a rule about wearing masks. I don't wear a mask when I'm sitting at an outside table at a restaurant with my father or other family members, but I do not sit at indoor tables at restaurants at this point in time. I don't wear a mask, of course, when I'm alone in my office or anywhere else. But when I'm in my office with people who have been vaccinated, have recently recovered from COVID, and they understand, we both understand each other's status. If it's a small number, 1 or 2 people, I offer them the opportunity not to wear a mask. And then when I practice music with my 2 friends, both of whom have been vaccinated, we don't wear masks. When do I wear a mask? When I go into any public space, if I go into a store or a restaurant, even if they don't require a mask. When I say I go into the restaurant in order to go outside, I don't dine in a restaurant at this point in time. When I'm in any large public space, such as a football stadium, even if we're sitting 6 feet apart, when I meet with a small group of people as part of my work obligation, I will wear a mask then. When I'm at my Kung Fu school, even if we're 6 feet apart, and when I'm walking on campus for reasons that I mentioned. The other thing I think it's important to reiterate, and something that I always try to remember, at this point in time, there are no absolutes. No one knows with certainty what is going to happen. We don't know if we're going to see new cases or not. And I get a little bit tired of hearing pundits on the radio and on television saying, oh, this is or isn't the case. We don't need to wear masks. We shouldn't get vaccinated. That's not what I know. All right. We all have to carefully and consistently review all the available information and data from people who know what they're talking about. And we need to be prepared to change our approach. This week, we're lightening up. We're saying there are times when you don't have to wear a mask. That's very reasonable. But we also have to understand that we may have to change back again. And perhaps most importantly, it's really important. People say, well, wait a minute, if I've been vaccinated, why do I need to do any of this stuff? Well, vaccines are very effective, but so far the CDC has had over 7,000 breakthrough infections reported. That is an infection in someone who's already been vaccinated, and including 88 deaths. So yes, the vaccines are very effective. They're not completely effective. And that's why, even though we're getting vaccinated, at least for the near future, we need to wear masks and social distance at those times when it makes sense. So the pandemic is progressing globally. Unfortunately, it appears to be getting worse globally. In the US and in our region, it seems to be stable, though perhaps not slowing down as much as we would like. The CDC says that if you've been vaccinated, you can lighten up in some cases. And the governor has said that the overall situation in our state justifies removing the local ability to require mask mandates. None of this changes the common sense approach that we've said all along, which is this is a virus that spreads from one person to another. You need to reduce the risk of that happening. The best way right now is vaccines, and then wearing masks and social distancing also help. And that's what it means for me. A lot more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please contact Jan Stork at storkj@etsu.edu. As always, thanks to Melissa White for helping to collate the data, and Dara Young for editing, producing, and posting this video. If you have any questions, anything that comes up, we changed what we were going to cover this week completely based on the questions that we got. So I look forward to hearing from you. And until then, please be healthy. Thanks a lot.